Hello and welcome back to our YouTube series where we interview various specialities in the field of internal medicine. Today our focus is family medicine and we have a special guest, Prof. Cooke, who is the head of family medicine and primary care at Wits, under which falls the departments of family medicine, rural medicine, sports and exercise medicine, as well as emergency medicine. Good afternoon, Prof. Cooke. Thank you so much for your time. We really appreciate it. So we're going to start off with a really simple question. What exactly is family medicine?
Well, it's a pleasure to be able to contribute and share some of this knowledge and experience with you. So family medicine is essentially a discipline that is involved in the care of patients within the family context, principally by definition, that really speaks to the context in which the patient is living, is engaging, critically sees the patient as a person in that environment in which they're working, and takes cognizance of the individual within the home and family environment, but also within the context of the community in which they are living or working or existing.
It truly is a holistic view of the patient. What exactly of family medicine drew you to the specialty?
So on a personal level, I was very interested in access to care and the equity of access to care. So what is the fairness of that? And that was what first got me involved in medicine to begin with. And for family medicine as a discipline being involved contextually at the primary healthcare level and within the district health system, I felt that I could contribute within that context and with that motivation to look to improve on access to care for patients and individuals within that system.
I know you're a very busy person. We've seen that in the introduction. But what does a typical day in a family medicine physician look like? And does it allow for a good work-life balance?
So a day typically may be spent in seeing patients in that dedicated clinical setting up front, and then being further involved in clinical governance initiatives, in training initiatives, in quality improvement initiatives, at community level, at facility level, primary healthcare facility level, and within the district as a whole, through the rest of the activities of the day.
And just from speaking to you for a few minutes, I can already understand what a fulfilling job it is. But what would you say is the best part of being in family medicine?
I think, again, I speak personally in that the privilege that comes with being a family physician and working in the family medicine space, the privileges are multiple. One is that we do really get to see, to experience, and to assist the patient in their own context, as people living the lives that they lead, and we get to understand exactly that for patients as people. And there's a richness to that. There's a privilege. There's an enjoyment that comes from that. To be able to also understand and work with such a variety of both clinical leadership, clinical governance, quality of care initiatives on an individual basis and on a district basis or on more of a community level basis. That diversity of activity that one can get involved in as a leader of a healthcare team or multiple healthcare teams across the district space is also really satisfying for us as family physicians.
And conversely, or just for argument's sake, what is the most difficult part of being in family medicine?
I think one of the more challenging aspects of it is that traditionally healthcare in South Africa has been very much a hospice-centric has had a very hospice-centric focus, and that has meant that there's developed a sense of very much a specialist discipline focus. And family medicine, working at a primary care level with not necessarily being at a tertiary or secondary level, has struggled to gain acceptance and understanding for the contribution that a family doctor, A as a GP, B for those doctors within family medicine and community medicine who are working in rural practice, and C for those who are essentially working in the primary care space as opposed to the specialist arena, the contribution that they make and the value that they bring to healthcare, both at an individual level and at a community level.
What other specialities do family physicians routinely work closely with in a multidisciplinary system?
Well, just as I spoke of the pleasure that it brings to work with, to do a number of different tasks in a variety of different settings as a family medicine doctor or as a specialist family physician, in my case. Equally so, we get to work with a multitude of different professionals and cadres of healthcare worker.
You emphasized the need for an increased uptake in the field of family medicine. If one were interested in the field, how would they go about specializing, and would you have any advice for them?
So first of all, one can make a significant contribution and a very valuable, in-depth, comprehensive contribution without specializing, as for example are many expert general practitioners and other doctors working within the state sector, for example, do. To specialize, however, in family medicine, the interest can be piqued, the interest can start perhaps during the undergraduate program, but certainly within the 6 months of family medicine related internship at the end of during the second half of the 2-year internship program. In fact, the second half of the second year of the internship program. It's at that point that an intern will spend 6 months in the primary care space, including emergency medicine as a discipline, which is critically important, but otherwise in the clinics and the community health centres in the district hospital. So there one can start to think about and develop a knowledge of family medicine and what it just might be like to work a little bit more within the primary healthcare space. The community service then follows, and there are many settings in which again one would be encouraged to apply to, such as in the rural setting where family medicine is so aptly and passionately practiced as a discipline. And in the many district hospitals and slightly more remoter settings than otherwise would be the case on the intern circuit. Thereafter, the further interest can be piqued for doing postgraduate diplomas in primary healthcare, for example, but ultimately an application to complete as a registrar the M.Med Family Medicine program, the 4-year family medicine specialty program is then the route to follow to become to be registered with HPCSA and the colleges of medicine as a family physician. In terms of tips, and I would just encourage that any prospective applicant to just have a close look at the richness and diversity that a daily job in the world of family medicine, and as a family medicine specialist, as an expert generalist, does provide, and critically evaluate for yourself as to whether that fits for you as an individual. It certainly has for me, and I'm very pleased to have taken this route.
So as you know, our healthcare system does face many challenges. How important would you say is family medicine in the strength of the overall public health in this country?
So we have significant challenges in the South African healthcare system that need to be urgently addressed. And without question, all of the healthcare workers, professional, belonging to professional bodies or others, who work within the primary healthcare space in the district health system are critical to dealing with those issues. It is the upstream initiatives of working to prevent illness, to promote good health, and to work in improving access to the healthcare system within the primary healthcare space, where many of the solutions to our challenges lie, not least across what is traditionally known as the quadruple burden of disease. And family medicine is a critical discipline to assist in addressing some of those challenges and certainly providing some of the solutions.
And then just something more recent, the COVID-19 pandemic obviously has disrupted many people's lives, but in particular in your field, how has COVID-19 impacted your field and how has it had an effect?
So, to speak personally of my involvement perhaps in the COVID-19 pandemic and the contribution that I've attempted to make as a member of different teams, certainly the primary healthcare readiness of the facilities and the communities around the beginning of the first wave to deal with, to triage, to screen, to appropriately manage those who presented with COVID-19 symptoms, and protecting those who didn't at the same time within those spaces was a critical role that family medicine has played within the primary healthcare facilities in the state context. Across South Africa as well, and myself included, family medicine has played a significant role in the establishment, running of COVID field hospitals, both the Nasrec field hospital here in Johannesburg and the field hospital in CICC in Cape Town were run and assisted significantly by the family medicine discipline per se. And then, of course, in the vaccination drive as well. Yes, on the one side, to be involved in the testing and screening of patients, of individuals coming to the facilities earlier on before the vaccinations. That then morphed into a critical role with regards the setting up, training, running of vaccination sites in many different settings. Again, along the ethos, along the lines of wanting to prevent illness, promote good health. Vaccination is a key family medicine intervention.
Thank you so much. That brings us to the end of the interview. Once again, thank you so much for your time, sharing your knowledge and experiences with us in this field. We truly do appreciate it, and this video will be beneficial to the many people who watch it.
Thank you. I really appreciate this opportunity. I'm a real privilege to be involved. And thank you very much for being able to provide some of the information.
Hello everyone. Today's random medical fact is about grafts. You might already be familiar with skin grafts or even bone grafts, but did you know that nerve grafts are also possible? So a nerve graft is a piece of nerve tissue that is surgically transplanted into a patient, and its extraneural support tissues will then guide and align the outgrowth of axons from the proximal stump of a discontinuous nerve to its target, thus aiding in the repair of the nerve.